Are you experiencing any heart-related concerns? This video aims to address the indicators of an unhealthy heart. It is divided into two sections. The initial part focuses on identifying 7 symptoms that may suggest cardiac issues. The subsequent part delves into elaborating on these 7 signs. We encourage you to watch the entire video for a comprehensive understanding. Stay tuned to discover the crucial signs indicating potential heart problems. Number 7. Ulcers. Those sores that don't heal on your legs or feet could indicate poor circulation. It may be due to arterial insufficiency or some obstruction in the artery that irrigates that area. Usually, people won't be able to walk far or fast due to their legs becoming more tired and sore, or even having cramps most of the time. These ulcers are painful. Number 6. Xanthelasma. Xanthelasma, a yellow plaque on the eyelid, is a common cosmetic issue without pain but slow growth. It belongs to xanthomas, cholesterol deposits in the skin. Predominantly affecting middle-aged women, it typically appears on the inner corner of the upper eyelid. Around 50% of individuals with xanthelasma also have dyslipidemia, high cholesterol, or high triglycerides. Interestingly, only 1% of those with high cholesterol develop xanthelasma. However, researchers have discovered an increased risk of heart disease, heart attacks, and strokes in individuals with xanthelasma. Number 5. Loss of hair. Hair loss on the thighs, specifically starting on the shins and spreading to the thighs, may indicate peripheral artery disease, PAD, characterized by leg artery blockages. Since atherosclerosis affects multiple arteries, leg blockages could suggest blockages in other areas, including the coronary arteries supplying the heart. Hair loss occurs due to inadequate circulation affecting hair follicles, which require proper nutrients for growth. Many with PAD become aware of the condition only in its advanced stages. Number 4. Frank's sign. A small sign in the ear can show that the person has a blockage in the coronary or carotid arteries. Back in the 1970s, Dr. Sanders Frank noticed that many of his patients with angina chest pain had a diagonal crease in their ears, which he called Frank's sign. But 70 people have it, and the younger the person, the more likely it is to be a sign of coronary obstruction or carotid. Only 40 out of 100 people with heart disease that causes blockages will have this sign, so you shouldn't be happy if your ear is flat. Number 3. Arch or senile halo. It is more common in older patients. It is caused by cholesterol deposits at the edge of the cornea and looks white or gray, which is visible above and below the outer part of the cornea. In some people, this halo can take over the iris, the colored part of the eye person. You can notice that before you had a dark eye, and now it's getting lighter. The senile arch does not affect vision and does not need treatment. Still, there is a caveat if the senile halo occurs in younger people before age 45, maybe signaling that the person has severe dyslipidemia. Number 2. Cyanosis. Cyanosis is that bluish coloration or bruising on the skin. Could it be that it's too cold and it's purple? It can, but it could also mean you have a heart or lung problem. If an area of your skin appears blue cyanotic or purplish when you are hot, this could be a sign that this part of your body is not getting blood oxygenated. Number 1. Swelling in the legs, ankles, and feet. Swelling in the legs and ankles, known as edema, can result from either cardiac weakness or fluid retention. Signs include tight-fitting shoes, puffy ankles resembling dough, and the appearance of a dimple when pressed, known as a locker sign. Swelling is typically more noticeable later in the day due to increased leg vein pressure from gravity. Elevating the legs while lying down helps alleviate the swelling. What are the 7 symptoms suggesting a potential heart issue? Number 7. Persistent cough. Persistent cough with white or pink phlegm means they have fluid in thans. Therapy will help if you didn't important. Don't let that cough look for a doctor. Number 6. Shortness of breath. You should be aware of the shortness of breath or dyspnea, especially when you try hard. It's extreme fatigue to efforts. You get more breathless with everything you do. It could be a heart problem. Number 5. Generalized weakness. Feeling tired all the time and having difficulty in everyday activities such as shopping, climbing stairs, carrying groceries, or walking is because the heart cannot pump enough blood to meet the needs of the muscles and tissues of the body. Number 4. Nocturia. When you wake up, you have to wake up many times at night to pee. This is called nocturia. There are many causes, but if the heart is not pumping properly at night, this excess liquid needs to be eliminated. Number 3. Shortness of breath. When you go to bed, the person starts to put more pillows to see if you sleep better and over. You cannot lie down. You have to sleep in a chair. You can also wake up suffocated during the night, which we call paroxysmal nocturnal dyspnea. This speaks volumes in favor of a heart problem. Number 2. Intermittent claudication. When you walk a few meters, you feel pain in the calf and the calf of the leg. It's not pain time is when you make an effort, and when you stop, it gets better. This symptom means that the blood is not getting there the way it should. When you stop, it gets better. When you walk, it hurts again. Number 1. Chest pain. When experiencing chest pain, it's crucial to consider the possibility of a heart issue rather than dismissing it as muscle pain or a simpler cause. Heart pain typically lasts longer than a few minutes and may manifest as pressure, heaviness, tightness, or burning. It can radiate to various areas, including the left arm, neck, back, jaw, stomach, and both elbows. Additional symptoms like sweating, pallor, nausea, and dizziness may or may not be present. If these symptoms occur, seeking prompt medical attention is essential to both diagnose and prevent potential heart problems. That's it for today. Thanks for watching. And don't forget to like and also subscribe to our channel for more interesting content.